Hi everyone, my name is Enoch and that's also my therapy center, and today I'm going to emphasize something on the prevention of childhood traumatic experiences. So the first one is focuses on family level interventions. So that one mainly comes about education and parental support. So coming up with the like taking children to school, then also educating them in several groups. Like there's a several organizations that teach about the harmful effects of coming up with the trauma, like abusing the children rights. So this also aims to emotional regulation and bonding and also attachment. It is a very paramount thing that to practice in life. Then also early identification of abuse and neglect. This is screening of the domestic violence, especially when there is an arise of maybe any form of violence like let's say sexual harassment, assault, and anything that happened to the child, like children, like neglect, especially when it comes to the basic needs, it needs to be reported. So it should be screened in the society. Then financial and housing assistance, it helps to prevent poverty, and then basic to take care of our basic needs, to prevent that behavior of depending. So it is also the important fact. So those they are essential in life that are needed, especially during the first childhood stages of life. So then the other one is a school and community-based program. These are the programs that are aimed to prevent the trauma, especially in school, like making the educators, teachers at school, and the one who give the lectures to be aware, to inform them and training them on the effects of the traumatic experience, especially in early childhood. Then also emotional support in class, especially in classroom, is also emphasized on that. This focuses on the comfort, like to the prevention of the emotional and psychological effects, especially the diseases that arise in future, like post-traumatic stress disorder. It is very important. So the community should be educated. And then also the bullying prevention. The act of bullying, the other one that we discussed, especially cyberbullying, should be addressed, and education should be there to prevent this issue of maybe cyberbullying, especially on the internet. The way I say that somebody can use the public photos, or maybe threatening somebody that I want to post to breach your confidentiality. So that is a very important factor, and we should be it should be focused on that to prevent adverse childhood traumatic experience. Then also health and mental health interventions. So the routine adverse childhood experiences should be, the screening is necessary. Then also accessing to mental health services, so like the professional counseling, and also playgroup therapy. It is also a very important factor, especially the children of the growing stages. Then also the one who are affected can be sent, there is a certain technique that is used in psychological cognitive behavior therapy, especially in children, that aim on trauma focus. It is specifically on trauma focused in psychology. Then also the professional psychologists and counselors are also encouraged. Then the other is policy, legal protections, especially the government policies to implement this decision on protection of childhood traumatic experiences through maybe curbing the certain vices in the society, like rape. Then also there's also assault and other cases. Then also prevention of the certain vices like witnessing your caregiver or maybe a parent being harassed or maybe assaulted is also something that is very bad, and it can lead to the development of even post-traumatic stress disorder when a child develops the adult life. There's also community and cultural strengthening. So this is building of infrastructures and some essential practices in the community that help in the support networks to curb the and prevent the post-traumatic stress-related disorders and the memories. So it is a very important thing in the life. So then lastly, we should be ready to focus on this childhood traumatic experiences, especially during when we leave the baby at home with caregivers. We need to be also aware to give them training and the program that are very well, so that our children are left well. Then also the parents, as a parent, you have to give them time, like giving attention, dedicating something. Even if there is a lot of plans that you want to make, we have to be dedicated to spend some time with our families. It is a very good thing because it brings about attachment and that bonding. So thank you, that is my presentation.